Well, now you have some basic knowledge of the anatomy of the brain and brainstem, spinal cord, the spinal nerves, and this is a perfect time to apply your knowledge. In this session, we will try to find all these parts of the central nervous system on the images, such as CTs, MRIs, and T1, T2 weighted MRIs. My goal is not to go into the details of all these techniques, but we usually do in the radiology department, but to help you to identify the structures which we have learned on the different modalities. So let's begin. First of all, I would like to introduce you this website. It is called IMA iOS, and I'm using it for all my demonstrations and all my explanations of the anatomy. We can easily find all the images we need here. For example, if we are learning the ankle region, you can click on the ankle and see what is available. And now we're talking about the brain, so let's click on the brain and look at the easiest image, which is the CT image. Now we are looking at the axial CT image. That's mean we slice body from up down, and the sagittal CT is also available, and here we slide the body from the left to the right side. And on the coronal CT image, we look at the body from front to back. Now let's compare the axial CT scans with the axial MRIs. What is the main difference between them? How can we differentiate them? And first of all, you need to look at the bone. The bone is absolutely bright, absolutely opaque on the CT images, and it's true not only for the head and neck, it's true for all the other regions of the body. The bones on the CTs are always as bright as they are on X-ray images. And on the MRIs, you see here, the bone is not so bright at all. It is made of two dark layers with some whitish contents between them, right? These two dark layers are the layers of compact bone, the external and internal laminas of compact bone, and diploic layer with some fat and some blood vessels. And this diploic layer is represented like whitish layer sandwiched between two dark layers. So you can see the difference between the appearance of the bones is obvious, and as soon as you see this difference, you immediately can tell is it MRI or CT. And the second feature, just look at the brain. On CTs, the white matter is a little bit grayish. It's darker than the gray matter, which is supposed to be darker, right? So we have kind of reverse coloration here. The gray matter is lighter on the image than the white matter. And for the MRIs, here you see the gray matter is grayish and the white matter is whitish, the way it's supposed to be. The T1 and T2 weighted MRI images are the most commonly used, and they appear slightly different and sometimes they can confuse you. So let's make the differences between the T1 and T2 clear from the very beginning. It will, make your life in the future a little bit easier. So, what are these T1, T2? They are just different settings of the computer which change the appearance of the image, focusing on one or another detail. The T2 weighted images, they allow us to see the edematous and normal fluids easily and quickly. As here, for example, you see the cerebrospinal fluid inside of the lateral ventricles and all through the ventricular system of the brain, right? And you also can see a thin line. This is our subarachnoid space. It continues all over the gyri and sulci, right? Here it is. If patient has trauma, edema in one another area, this area would appear bright as well because it will have some edema, the post-traumatic edema. And it's easy for clinicians to look through the T2 weighted images and identify the pathology quickly. T1 weighted images, they don't have this feature. They do not highlight the edema and liquids of the body, but the um, fatty tissues, the superficial fat, the fat inside of the orbit, as you see here, the fatty tissues, they appear bright on T1 weighted images. Now we are ready to look at this sagittal MRI image, which is definitely T1, and identify the main subdivisions of the brain. Starting from the very top, here above we have the cerebrum. Cerebrum is the first, the largest part of the brain, and below here we have the corpus callosum, the bridge which connects the right and left hemispheres of the brain, and it demarcates the brain from the diencephalic region. The thalamus and hypothalamus, the structures of the diencephalon, they lie just under it. Below here you can see the midbrain. The midbrain is this narrow part between the pons below and the thalamic eminence above. Pons, it's made of transverse directed fibers, and it connects the right cerebellar hemisphere with the left cerebellar hemisphere. The cerebellum itself is on the back here, this structure. Well, below when pons we have medalia oblongata, and you see as soon as medalia oblongata passes through the foramen magnum, which is right here, it becomes the spinal cord. And we can identify all these parts of the brain on the axial images as well. You can follow this blue line on the left side of the image to see where exactly I am. So the first part of the brain is the cerebrum, the right and left cerebral hemispheres, which are subdivided by this longitudinal fissure along the midline here. As I scroll further down, I can see the second part right here. This is our diencephalon with thalamic eminence. This oval-shaped structure right here is the thalamus, and some gray matter around. This gray matter, it represents the collections of the neurons in the subcortical areas of the brain, and they collectively make the basal ganglia. We're not going to talk about it right now. We're just gonna scroll further down until this Mickey Mouse sign in the middle, which represents the midbrain. And next structures are right here, the pons anteriorly and the cerebellum posteriorly. The cerebellum has two hemispheres, as well as the cerebrum, the right and left, and they are linked by these fibers which make the pons. As I scroll further down, I can see the shape changes again, and this structure in the middle here is the medalia oblongata. Medalia oblongata, it leaves the cranial cavity passing through this oval-shaped foramina, you see, and becomes the spinal cord. So the structure in the middle now is the spinal cord with two vertebral arteries, right and left vertebral arteries on both sides. Each part of the brain has its own ventricle inside. So for our cerebrum, the proper ventricle is the lateral one, and you can see the C-shaped spaces inside of the cerebrum. Each hemisphere has its own lateral ventricle, and this ventricle has some extensions. The anteriorly, these two extensions, they're called the frontal horns. The occipital horns are in the back here. The temporal horns, they enter the temporal lobe and extend even further down. So the lateral ventricle is a cavity of the cerebrum. As we go further down, you can see we have a cleft just in the middle here. It's kind of squeezed between two thalamic eminences. We have two thalamic regions on both sides, and the space between them, this is your third ventricle. So the third ventricle, it belongs to the diencephalon. And you can see that the third ventricle, it communicates with the lateral ventricle, while these two tiny channels called interventricular foramina or foramina Monroe. From the lateral ventricle, the cerebrospinal fluid enters the third ventricle. As I scroll further down, you can see our Mickey Mouses in the middle, so this part of the brain is the third one, the midbrain. And here we have a tiny black dot in the dorsal part of the midbrain. This is your cerebral aqueduct. So the cerebral aqueduct is a cavity of the midbrain. And it expands again into this big fourth ventricle, which is located just between the pons anteriorly and cerebellum posteriorly. Again, we have some vessels inside of the fourth ventricle, which secrete the cerebrospinal fluid. And in the very end of the pons, we can see we have three apertures, three black spots here. 1, 2, 3. They are the foramen Luschka and foramen Magendie, the ones which allow the outflow of the cerebrospinal fluid from the ventricular system out to the subarachnoid space. This is the way how the cerebrospinal fluid leaves the internal space within the brain and enters the subarachnoid space on the surface of the brain.
Now let me switch to the sagittal MRI image. The bodies of our vertebra are all located anteriorly here, and the bony processes which are just behind are the spinous processes. We have some space between them, between the arches and bodies. This is the vertebral canal. The spinal cord is running down through it. What are these particular spaces between the vertebrae? How do you think what they are? They are the IV discs, the intervertebral discs. And we usually look how symmetrical, how identical they are from up down. And the whitish center of the interventricular disc tells us that the disc is healthy. The nucleus pulposus is in the center, so it works as a spring, allowing us to move our bodies. The axial image shows us the anatomy of the vertebrae, and again you see the bodies are in front, the vertebral arches are behind, the cerebrospinal fluid inside is bright, so we're dealing with T2 MRI, with the grayish substance in the middle, which is the spinal cord. And you see in some areas, as I scroll up and down, the pedicles which are right here, they kind of disappear and they open the space. This space on both sides is the intervertebral space, which allows the passage for the spinal nerves. Of course, this distance between the body and arch here is important to evaluate, as it allows us to understand is there enough space for the spinal nerve to pass or not. The bodies disappear on some levels. Is it normal or pathological? Of course it is normal. That means we are at the level of the intervertebral disc. How can you understand which level you are at and which exactly a vertebra is one or another? It's easy looking at this image here. On my left you see the sacrum just below 5 fused vertebra with the coccyx attached, and the first IV disc is the one which belongs to L5. So we call the vertebra above as L5 and the disc below it, it belongs to it, it's the IV L5. The next one is L4 and the vertebra is L4, 2, L3, L2, L1. So I'm now at the level of L2 body vertebra. The same numeration is for the intervertebral foramina between the vertebrae. Then each intervertebral foramina below the vertebra has the same number as the vertebra above, and accordingly the spinal nerve which leaves this space, it also has the same numeration. So we are now at the level L2. So as I scroll down here, I can tell that the nerve which passes here is L2, as well, and this IV disc, which is just in front of the vertebra right now. This is the second lumbar intervertebral disc. Let's look at the MRI now, as it allows us to see all the structures much clearly. The muscles behind, you see the abductor spiner, the bodies of the vertebra, the perfect foramina here, the other intervertebral foramina with the contents. The contents are nerves, of course, IV discs, which are quite healthy. So I would say this vertebra belongs to a young person. And as I go further toward the midline, right here, I can see the vertebral canal with the spinal cord inside. Let's change the contrast to T2, and now the cerebrospinal fluid is already opaque, it is bright, and you even can see the conus medullaris right here. Can you tell me at which lumbar level it is? Yeah, you're right, it is quite high on this image. It is at the level 81, and everything which is below here is the cauda equina. And as I scroll more laterally, you can see how the nerves of the cauda equina, how they run laterally and downward to reach the corresponding intervertebral foramina. By the way, the distance between the posterior surface of the vertebral body and the vertebral arch is quite important, as it shows us is there enough space for the cauda equina and for the conus medullaris or not. Especially beautifully the cauda equina appears on the axial images. And now I'm at the level T12, and you see the conus medullaris in the middle of the bright central canal. So we are dealing with T2 MRI. And as I go further down, you will see a bundle of dark dots inside. So this is our cauda equina. And as pedicles disappear, that means we are at the level of the intervertebral foramina. You can see a nerve which exits this foramen right here. This is the nerve number L1, because I'm at the level L1. And the next nerve, which is the closest one inside of the vertebral canal, this one is the traversing nerve L2, and it's gonna leave the canal at the next intervertebral foramina right here. So one by one, these nerves, they leave. This is the L2 spinal nerve right here. So the size of intervertebral foramina is important. It must provide enough space for our spinal nerves to allow them exit the spinal canal. And you see some other dots inside of the intervertebral foramina, right? These dots are arteries and veins, the medullary arteries and veins which supply the spinal cord itself. Of course, you understand if the intervertebral disc is damaged, if it is destroyed with age, like in old people, usually they degenerate, or if some herniation of the nucleus pulposus happen. In that case, the space between two adjacent vertebrae become narrower, and accordingly the diameter of the intervertebral foramen also becomes smaller. That can squeeze the nerve inside and provide the chronic back pain and such conditions like sciatica. Especially the L5 intervertebral foramen is vulnerable to injury. You can see it is a little bit narrower from the beginning, and the vertebral bodies, they change the angle here. So the L5 intervertebral disc is the one most commonly suffering the largest pressure and commonly herniated. So this intervertebral space and IV disc, the L5, they are vulnerable to damage.